All right. Thank you so much, Faith. I'm Rhonda Barkus. I'm the manager of the RIPT project. Thank you all for joining today's Health and Education Learning Program webinar around the topic of organizational leadership and value. So the objectives for this is being able to recognize essential components to being a credible, influential, and empathetic rural health leader in a value-based context. Identify likely barriers and resistance to value-based care and value-based payment and potential approaches to address them, and to reflect on your leadership in a value-based care context and identify areas for growth and action. So with that, I would like to welcome our guest speaker, Dr. Jennifer Lundblad. She is the president and the CEO of Stratus Health, which is an independent nonprofit organization that leads collaboration and innovation to improve health. Dr. Lundblad has an extensive background in leadership, organizational development, and program management in both nonprofit and educational settings. She has a BA in speech communication and economics from Macalester College, an MBA in public and nonprofit profit management from Boston University, and a PhD in education with a focus on organizational development from the University of Minnesota. Her dissertation research was teamwork and safety climates in small rural hospitals, and she's published articles in peer-reviewed journals on topics related to health quality and organizational change. Dr. Lundblad is a member of the National RUPRI, which is Rural Policy Research Institute Health Panel, the University of Minnesota's Rural Health Research Center Expert Work Group, and serves on various other national and local boards and in committee leadership positions. She has an adjunct assistant professor appointment at the University of Minnesota School of Public Health. We are honored to have you with us for this hour, Dr. Lundblad, and I'm going to thank you and turn it over to you.
Well, great. Thank you, Faith, and thank you, Rhonda. It's just such a pleasure to be with all of you today, and especially to see a few friends as I watched people signing in. I'm excited to talk with you about the topic of leadership, particularly leadership in a value-based care and value-based payment context. And knowing that all of us, whether we're in a role that has a title that's formal leadership or in a more informal role, we're all on a leadership journey. So thank you again for the invitation and for your time and attention today. I think you've seen this before if you've participated in others in this webinar series, but this is all, as Rhonda said, part of the Rural Healthcare Provider Transition Project. This all comes to you courtesy of the Health Resources and Services Administration, or HRSA, a part of U.S. Health and Human Services. And just to be clear, I'm representing Stratus Health and Rural Health Value, so these are not comments from HRSA or Health and Human Services. So Rhonda also reviewed for you what our plan is for our time together today. I hope you leave with an understanding of the essential components to being a credible, influential, and empathetic rural health leader in a value-based care context, that you will have a better sense of the barriers and resistance that you might anticipate or have already received on your value-based care and payment journey and how you might address those. And then some opportunities for you to do some growth and development and kind of figure out some actions that you might take as a result. So I like to think of this as a combination of kind of bringing your hearts and minds along, but also leaving with you with some very specific tactics and strategies that can be helpful to you as leaders. So I know that you, if you've participated in any of the other webinars in this series, have been exposed to this notion of value, and there's probably a wide range among you about your understanding and your experience when it comes to value. But I want to just make sure we're all grounded. So this is probably a refresher for most of you, but the notion of value really took off with the passage of the Affordable Care Act in 2010, and the term and the usage of it have been evolving since then. So we started kind of thinking about the value equation, which is quality plus experience as it relates to cost, as how we define value. Then that's kind of shifted to, as we adopted the phraseology around the three-part aim or the triple aim of improved community health, better patient care, and smarter spending. And now more recently, we've started talking about this health system that achieves equitable outcomes through high quality, affordable, and person-centered care. And I expect that this will continue to evolve. So if that's the evolving understanding of value, then what is value-based care? Well, value-based care has the components that are listed here as really the differentiators between it and fee-for-service or volume-based care. So value-based care really emphasizes prevention and wellness, so moving upstream in addition to the treatment of illness or chronic condition. It's focusing on improving outcomes, helping patients navigate this very complex healthcare system that we have, integrating and coordinating care, serving as that, again, sort of navigator and coordination function, and then helping patients address their health-related social needs or the social care aspects that happen outside of the walls of traditional healthcare. And so the value in value-based care is really derived from measuring quality and patient experience against the cost of delivering those health outcomes. So in that context, why focus on leadership? Well, today's world really calls for that. We are in an incredibly rapidly changing healthcare landscape that requires effective leadership so that there's both a clear vision and then the execution of work toward that vision, whether, again, you're in a formal or informal leadership role. And importantly, those of you who are leaders in a value-based care context have to kind of at the same time and sometimes paradoxically do improvement of care delivered to patients, increasing the health of the community that you're serving, while at the same time reducing the per capita healthcare costs. That's a pretty complex combination of things that leaders are all holding as you're in a value-based care context. And then rural, on top of it, possesses some special challenges for those in leadership roles. You may not have a close cadre of peers with whom you can share ideas and experiences and learn from each other and problem solve together. Yet we know rural health leadership development is critical for your own growth and professional effectiveness. And that's why your participation in RHPT is so important. So kudos to you for that. I also think I saw some names from those of you who might be participating in the NRHA CEO or other certification programs and other opportunities. So again, credit to you for being proactive about your own leadership. So what do we mean by leadership? Well, it can actually be a little bit hard to define, or maybe a better way to say it is there are many definitions. But when we think of leaders, we might think of a steadfast focus on a goal despite having competing priorities and other distractions. Or we might think of it as someone who's charismatic and engaging as a leader, or somebody who's quietly and humbly pursuing an ideal, or an affirming style that inspires people to work together. All of those examples are different competencies that are part of leadership in action. So then we kind of ask ourselves, why are some leaders more effective than others? And how does a healthcare leader assess his or her leadership competencies and then improve them? Well, the really good news is that leadership skills can indeed be developed. I cite for you 2 studies here, but there are many studies and much research that tells us that you don't have to be a born leader, that in fact, it's a set of observable behaviors, and with intentional and deliberate practice, people can learn to be more effective and make more of a difference in the workplace, in their community, in the world through the development of those leadership skills. So again, I hope that's why you're here today and are interested and engaged to do that in your own leadership development. But leading in a value-based context is a specific context in which we take all those general value and leadership characteristics and bring together the ingredients that we're going to be talking about today. So as a rural health care organization leader, you both need to be on board and then communicating, really leading about what that vision is as you transition to value-based care and payment and why you're on that path, whether you are early in that journey, just looking into that journey toward value, or have taken some action and taken some steps, which increasingly rural organizations have. And then to always be thinking, who are you leading? It's certainly your clinicians and staff, but it's also your board or your trustees, and it's members of those in your community. So with that kind of grounding and resetting, let's talk about value-based care as a leadership endeavor. So if as you, as a rural healthcare organization leader, are transitioning from volume to value, and again, wherever you are in that journey, you are leading your organization to new skills and resources. You're leading and making decisions about what investments to make in the capacities that you need to deliver value-based care. And you're doing all that while being attentive to what the local context is, what your organization and your community have and are bringing to the table. What does your environment look like? What are the partnerships and collaborations that you have? What kind of testing or experimentation have you done or could you do? And how do you continually learn? The visual on this slide is a motorcycle. We on the Rural Health Value team often talk about the road and the path to value and the various components that are needed and the lane shift that occurs along the road as you get more sophisticated and advanced in value, and the car or the motorcycle and what the engine represents and what the body represents. And here the signal is to the wheel. The leadership is what drives and moves this forward. And if you look really closely on this slide, you'll actually see a little training wheel that we're kind of testing this in many ways in rural as we think about being on that road to value. The key to leading in a value-based care context is grounded in organizational culture. What that means is that value-based care and payment is hard because it's dependent on the culture of your hospital or clinic or other organization. So it's especially important for you as a leader to be attentive to the factors that contribute to establishing and sustaining a culture of value that values value, so to speak. Culture is, of course, the unspoken assumptions, norms, and expectations that guide how the people in your organization behave. It's the way things get done around here. It's kind of the unspoken ways that determine the behaviors and guide the behaviors of people in your organization. So I'm a CEO of my organization, and I can tell you to those of you who are CEOs or in other leadership roles, we don't get to write a memo that says we now have a culture of value. Just simply doesn't work that way. I wish I could tell you that was the case, but that's not that easy because culture is a collective characteristic. It's determined by those who are a part of it. So it changes, it's dynamic every time there is a new constellation of people in an organization, department, or division. But your leadership role is a critical one that shepherds that culture. And so I want to talk about each of these cultural success factors just briefly with you. So leadership engagement, the plan and the process, flexibility as a characteristic of culture, expectations that prioritize quality and value, and how we can celebrate the wins and the accomplishments that we have as we're on that road to value. So first, leadership engagement. It's really essential to have leadership for value in the form of visible commitment, how you allocate resources, and accountability throughout the organization, and that you personally are modeling the behaviors and the commitments that you expect for clinicians and staff. People in your organization and your community really do closely watch to see that your actions as a leader match what you say as a leader. So where do people see resources going and where aren't they going? How are staff and clinicians reviewed and rewarded for their performance and for their behaviors? What takes priority in training and development opportunities? So it's not just lip service. Believe me, people know if it's not a genuine commitment to value or if there's a mismatch between what you say and what you do as a leader. Secondly, it's also so helpful when everyone is speaking the same language and using a shared approach to the value-based care work and the efforts that are underway. So to systematically address the value-based care capacities that are important for your organization and that you need to be successful in a value-based care and payment context include, again, that plan and being very visible and transparent about the plan and the path. The common language, and so that probably requires some training and some behavior change as we all learn to use new language and to have that be done in some meaningful ways in our organization. And then how information is flowing and where those messages are coming from, including from you as a leader. So Flexible structure is the third on this list of cultural characteristics important to leading in a value-based care context. But it's also important to know that there's no single right way. You should be encouraged to be creative in how you redesign the work to be value-based. You should focus on what makes sense based on your needs, staff capabilities, and your community, and allow flexibility and engagement of a wide variety of staff and clinicians in both planning and in implementation. And as we all well know, if we've learned anything since March of 2020 and a global pandemic, it is the importance of flexibility amidst uncertainty. And people will certainly feel uncertain on the path to value in your organization. Next, I want to talk about expectations that prioritize value. At the highest level, so whether you're a CEO or another senior leader in your organization, and also for your board of directors or trustees, the organization's expectations for value should be clear. Quality and patient experience are what foster excellent patient care. There is this saying that perhaps some of you have heard, that it's being too busy chopping the wood to sharpen the axe. Another way is to not seeing the forest for the trees. It comes to mind if we're kind of have our heads down and are doing the day-to-day, which is essential and important. But if we're not looking up and providing that vision and leadership, and again, setting those expectations that prioritize value, it'd be very hard to move your organization forward. And when we think about quality, it's of course tied to health equity. We're fond of saying that Stratus Health that you can't have equity, can't have quality without equity. And in some rural places and for some rural people, there's sort of a double whammy when it comes to equity. First, the very nature of being in rural can mean inequitable access as determined by geography. And then for those who identify as a subpopulation or community who are treated differently because of personal characteristics or their social circumstances, they've been systematically denied opportunities to access the necessary health services and achieve their best possible health and well-being. Prioritizing value is being explicit about addressing those disparities. And then the last of these environmental factors is about, or cultural factors, is about celebrating wins. There's a lot of work to do on the path to value, and it can feel like the end of that journey is a very distant, far time and place away. But there's much to celebrate, and we should be pausing to celebrate along the way. And you as a leader should be encouraged to celebrate and recognize wins, even small wins, and not only within your organization, but with your partners and in the community. This helps people to feel appreciated and keeps them engaged in the work going forward. Another lesson learned of the pandemic is how important relationships are in the community with the social and human services partners that you have, with businesses, with schools, with local governments, all in service to keeping your community healthy and thriving, which is again essential and core to what we mean by value-based care. So a few tips, and then we're going to get to some of those tactical ways that you as a leader might be addressing the barriers and using some tools to develop and grow in your own leadership skills. So as you consider your role in supporting a culture of value, you can support the resources, time, and commitment to make these things happen. So first, we often say in the quality improvement world, if you can't measure it, you can't improve it. And this underscores the need for data in our decision-making and recommendations for change as we're on the path to value. Managing the process, not the healthcare providers or teams. The idea here is to look at all of the ingredients of a process or a system, not necessarily focusing on who or what needs to be changed in terms of a person, but looking at the process and systems that wrap around those. Let that data-driven measurement approach guide your team's analysis and recommendations for change. Third, putting the right data at the right time in the right hands. The maxim here is that when your team and process owners are properly equipped with good data, they'll be more likely to determine what the needed changes are to make that move toward value-based care, rather than saying, just do it or trusting your gut. And then lastly, creating an environment in which the people who do the work are engaged. We talked about this a little bit before, but it's really important to engage those who know the work and are at the front lines. They really have the ideas about how care can be value-based. as they understand value and as they begin to adopt and think about new approaches, because they're living and breathing the workarounds that sometimes happen when things aren't going as they should. So we often talk about care as envisioned and care as it is, and we really want to make sure those two things are aligned. And then lastly, as we just talked about a minute ago, quality and equity are inseparable. So I want to talk now, as I said, about some of those more practical or tangible ways that you as a leader can lead in a value-based care context. And we'll start by talking about what are the things you might expect in terms of resistance or barriers. So there are certainly challenges and potential unintended consequences as you're on the path to value in a rural hospital or clinic. You should be prepared to acknowledge and talk about the tensions. They're real. You and many other organizations have experienced them. For example, leading in a value-based context means that you're balancing short-term fee-for-service revenue against making longer-term investments, which will ultimately produce shared savings and incentives. But sometimes that feels pretty far apart when you have an immediate bottom line or a payroll or monthly expenses to meet. And so there's certainly a tension between short-term revenue and long-term investments that are toward value. Also, different types of investments that address medical needs from those which support community organizations to address social care needs. What does that flow of revenue and resources look like when we know it's just as important to address social care as it is to address medical care? I'll share an example that might bring some of this to life and could be something that some of you have experienced. In many rural communities, heart failure is prevalent. And so as you think about being on the path to value-based care, for those heart failure patients in your community, you might invest in the development of an outpatient heart failure clinic that can help patients manage their conditions, that can reduce admissions and readmissions, and reduce unnecessary emergency department visits. Well, all of that reduces revenue. And so again, it's this tension between what are we investing in short term, what are we investing in long term, and how do we balance those trade-offs? And there's no single path that's the best way, but being prepared to talk about and use data and work with your leaders and your teams to think through those tensions and those barriers and resistance is really important. This article that I'm citing and showing to you here was released about a year ago in the New England Journal of Medicine, called Reaching for Equity, Moving from Regressive Toward Progressive Value-Based Payment. And I'm calling out a couple of things from the article that I think really speak to where value-based care and payment has been in relation to rural communities and where it's going. So the article says, value-based payment programs implicitly prioritize well-resourced clinicians and health systems. Well, that's not usually a descriptor of rural. So there's a statement about why it has perhaps felt so hard in rural healthcare to move toward value, because there's been an implicit prioritization on organizations that aren't typically rural healthcare. And then secondly, I'm sorry, I think there's a typo on here. The second statement is the value-based care movement has traditionally prioritized reducing spending, but advancing health equity demands spending more on underserved groups with unmet needs. So I think I got a little bit of cut and paste here mixed up. But again, advancing health equity demands spending more on underserved groups with unmet needs. Again, another reason why it has felt challenging, according to this article, if you're in a rural community. But that the article is also speaking to are the emerging opportunities coming from, in particular, CMS, the Medicare program, but also coming from other payers, that says while value-based care and payment have generally not aligned to serve rural health care nor underserved communities very well, new models are emerging which will better enable rural healthcare organizations to be on the path for value. So while it was if you read the full article, it's pretty disheartening in the first part of it because it describes why it's been so challenging to date, but it's encouraging at the end because there are new models that are emerging that really are learning and can really work in rural. So as you're thinking about your work and these expanding healthcare payment alternatives that are getting better and better for rural over time, such as shared savings and bundled payments, the demand that a healthcare organization develop and deploy new organizational capacities to deliver value-based care is front and center for you as you're leading for value. So it's about facilitating or supporting community planning, coalitions, and connections, identifying resources and investing strategically. Again, think of that heart failure clinic example, and then engaging staff, clinicians, patients, and caregivers differently. So I'm first going to share with you a little bit about what can guide your focus and actions as a leader within your organization. And then I'm going to talk with you and share with you a bit about what can guide your focus as you look externally and in your community. So first, I think there's a really important assessment that you can use as a leadership tool to support your work, all about understanding what those capacities are that are important to value-based care and payment success, where your organization is, and how you can grow those capabilities within the organization. So our Rural Health Value team, the team that Stratus Health and University of Iowa co-lead, created the value-based care assessment tool now probably 5 or 6 years ago, and we updated and revised it about a year ago. It's been well tested and well used out in the field, and it's an assessment of 80 different capacities or best practices that are intended to be putting an organization on the path to value and that are created through a rural lens, categorized into 8 different topic areas. So the topic areas are governance and leadership, care coordination, clinical care, community health, patient and family engagement, performance improvement and reporting, health information technology, and financial risk management. So this gets us to the very practical, tangible, actionable steps you can take to be a leader, putting your organization on the path to value and addressing what those questions, concerns are, and trying to address them and have that shared vision across your organization. I'm going to share with you just a couple of examples within 2 of the domains that you could start to visualize how you might, by accessing this assessment tool, use it as both the assessment as it was intended, but also your guide as a leader to say, where can I be focusing my time and attention? How can I help foster and shepherd the path that we're on as an organization? Where is the best use of my leadership energy? So 2 examples in governance and leadership. So the first statement, so again, in a series of 80 statements or so, each organization would rate themselves to say this is fully developed, partially developed, we've just started, or we haven't even touched this one yet. So I think that's my words, not the formal words on the assessment. So in governance and leadership, you would kind of think about whether you and your senior leadership team includes positions that are identified by title or job description who have clear accountability to improve clinical quality and patient safety, improve the patient experience, advance community health, and lower total costs. In other words, do you have someone for whom value-based care is an accountable performance expectation? Again, this is something to use as a guide as you're thinking about what you can do as a leader. Create that position, support that position. Second, another example among the list on the governance and leadership domain are senior leaders employ regular walkarounds interacting with frontline staff. Because again, we talked a few minutes ago about how important that perspective of those on the front lines of care delivery and service and support have input into how you can design and deliver value-based care. In the clinical care realm, again, there'll be a whole set of assessments, statements in this domain, and I've selected 2 of them just to share as examples here. The first one that you would kind of check yourself against is we have an after-hours care system, for example, practice call line or extended clinic hours that supports access to care to help reduce emergency department use for non-emergent conditions. Again, a really important component of value-based care is getting people to have their care at the right acuity level and at the right time, so that you are, again, avoiding unnecessary emergency department visits is a great example of that. And then another one that's on the clinical care list is processes and training are in place to assure appropriate access to palliative care support, hospice services, and end-of-life care. We know we want to honor patient preferences when they are patients are at end of life or complex life-limiting conditions. And do we have, as a hospital or a clinic, the right services and support so that we can care for those patients who we also know are some of the most costly patients that a health system has? Again, an important component of delivering value-based care. So if that tool can serve also as a leadership guide, a bit of a roadmap for you in terms of what to do within your organization, I also want to share a little bit about what can guide your focus and actions in the community. So the goal in value-based care is to have assessments and strategies that are designed to enhance the health of all individuals in your community across a wide range of ages and conditions. And our Rural Health Value team has just recently released a new resource guide and an infographic that gives you as a leader a variety of toolkits, strategies, and information to help you initiate, improve, and inspire the community engagement strategies that can support value-based care. So the link to it is here on this slide. And then what I'm going to click to is the infographic that I think, again, can reveal some of the leadership actions that you can take, that you can consider as part of your strategy, that you can work with your board and with your community on. So again, community engagement sits in the middle of this information infographic. Community engagement is an intentional approach to working collaboratively with partners and people in the community to address issues and improve health. And around this circle, from the very top going to the bottom, is kind of, it also indicates the levels of trust that are needed as you begin to move through this community engagement. So it can start with networking, exchanging information that can be mutually helpful to you and a community partner. Moving to coordination, which is not only exchanging information, but actually changing what you do and sharing resources and knowledge, perhaps even sharing staff or space to allow coordination to occur between healthcare and community care supports. The next level is cooperation, actually sharing resources in support of joint activities. And collaboration. So the collaboration encompasses all of the above and working together to mutually enhance community capacity and impact. So while we're not taking time in today's session for this, I think it's always helpful to do some self-reflection as a leader. So I encourage you to, after our session, engage in some deeper thought about the culture of value in your organization and your role in promoting and supporting the culture. So here are a few questions that I think you could run on as the next time you're out for a walk, in your shower, as you're thinking about your own leadership. So first, I would challenge you to identify some recent examples of how your organization has celebrated quality and value. For example, could you name 2 or 3 from the past year? A second question for you to reflect on would be, if someone from outside of your organization was visiting your hospital or clinic, are there any easily identifiable artifacts, anything that they would see as a visitor that would reflect your organization's commitment to value? Third, what structured method for implementation of quality improvement efforts does your organization use, and how do you know it's used consistently? Quality is such a core component of value. And then lastly, how is accountability for value-based care distributed at your organization? Reflect on and think about opportunities to do that better. So I'll leave you with 2 pieces of parting advice from me and then one from Rosalind Carter. As I work with leaders and as I work with organizational culture, I will repeat again something that I alluded to earlier in the session, which is the importance of the alignment of what you do and what you say. That's what creates trust and credibility. And that's what allows you to do the second item on this slide, which is to be the leader you would want to follow. Anyone who's in a leadership session with me knows that that's a favorite phrase of mine, because I think it's a very simple way to say, if I put myself in someone else's shoes and view me as a leader, is that the leader I would want to follow? And then, because we're talking about something that's really challenging, being on that path to value-based care and payment, I offer you this quote: "A leader takes people where they want to go. A great leader takes people where they don't necessarily want to go, but ought to be." And I think we all ought to be on that path to value. So again, I'm here on behalf of both Stratus Health and Rural Health Value, and I would commend to you our Rural Health Value website. It is chock full of resources and tools, and can be very valuable to you in your leadership endeavors in value-based care and payment. And would wrap up my comments before I turn it back to Rhonda with a note of gratitude for all that you do to improve the lives of rural people and communities. Okay, so Rhonda, I will turn this back to you.
Thank you so much, Dr. Lundblad. And we do have some time for questions. So I encourage folks to put your questions in the chat box, or feel free to come off mute if you'd like to and actually use your voice. That would be wonderful to do it the old-fashioned way as well. And so while we're waiting for that, though, I will ask you a question, that's something that you were talking about. So a lot of us have heard that the saying something along the lines of culture eats strategy for breakfast. And I think that that is so true. And so I appreciate that you started off by talking about culture, and that if we have a strategy of moving towards value-based care, we have to make sure our culture is going to support that, because otherwise we put all these things out there and nothing's going to change. So as you were talking about those 4 success factors, and one that I thought was really interesting that you were talking about is that flexibility to actually create the culture, depending on what you see as far as the leaders, and figuring out how to do that specific to your organization, what your community is like. And I'm wondering, and I know that sometimes organizations, it's really easy to think that when we see a model that somebody else has done, we think we have to do it exactly that way. And sometimes it doesn't quite work. I was at a conference recently and heard Quint Studer talk about AIDIT, and that's of course his model for communicating with the patient: acknowledge, introduce, duration, explanation, and thank you. And he said that one of the things that he really is kind of this part 2 of all of that is that he thinks people used it so rigidly that it lost its intention. And he was really talking how to do it differently, so it was real and it stayed true to its intention, which was to help the patient feel safe. So all of that being said, I'm just wondering what kind of suggestions you have for an organization and for leaders on how to really look at their community and assess that to decide how to be flexible. Like, what would that look like?
Yeah, boy, it's a big question, and a lot tucked in there, Rhonda, but I really appreciate you circling back to culture, because you pick the meal. So culture eats strategy for breakfast, for lunch, for dinner, for whatever it might be. And it's so true that as you said, and as I tried to emphasize with all of you, no matter what your strategy is, if your culture doesn't enable that to be the path and the vision that is supported, then your strategy is not, it's gonna sit on a shelf and it's gonna gather dust. And being flexible is so key. There's so much we can learn from other organizations. That's why, the kind of program that RHPT is, and the kind of peer-to-peer support and networking development is so key, because we want to learn how others have solved similar problems. We want to learn what models have been successful in other places. And then I think the key is the critical thinking that all of you as leaders need to apply to those, to filter it and to sort it, to say, and what of that works for us? What are the essential elements, so that we maintain fidelity to a model or to a best practice or a piece of research, but even as we're maintaining fidelity to the essential elements, knowing what variation we want to put in there in order to make it work in our context. I've recently become a student of implementation science, sometimes called dissemination and implementation science. And that's really turned my attention to the notion and the importance of context and taking, again, evidence, best practice, emerging practice, and putting that in the context that you have in order to make it successful in implementation. And again, that requires critical thinking, probably requires conversation and learning, requires hearing from those frontline staff and hearing from community members as you're figuring out how to be flexible and adapt and trying to understand, again, how far is too far that takes something away from the fidelity to that core or essential components, but also then recognizing what that flexibility is. So there is no magic wand to wave. This is the hard work of leadership to do that.
Well, I appreciate you reminding us that it includes talking to the frontline staff as well and getting input from them. It's not just leadership. While leaders lead it, it doesn't have to be just driven by leaders, because it's going to be up to the frontline staff as well to create that different culture. So
Yeah,
appreciate you saying that. All right. Other questions? I don't see any in the chat box, but I'm wondering if anybody wants to come off of mute and ask Dr. Lundblad a question.
Rhonda, could I ask the group a question? They can either pop it in the chat or come off. So in those self-reflection questions that I left you with toward the end, I asked you if there was any visible way that someone might see your commitment to value or quality and value if they were to show up in your hospital or clinic. And I wonder if anyone had anything come to mind as you think about what that kind of visible display of commitment to value or quality could look like. So if you have an answer, pop it in the chat or take yourself off mute. I'd just love to hear what I know of some examples. I'm just kind of curious to know what examples might have come to mind for any of you.
I'll jump in on this. Well, so at our hospital, it's really, well, I don't want to say unique, because there are other hospitals where you get a very warm feeling from the staff, but the staff truly care. You can tell. And you get this warmth from the front desk person onto the nurses, onto the physicians. It's truly amazing how you get that feeling. And from the first day when I walked in, and by the way, it was the first rural hospital I'd ever been to. I always worked in big cities, big hospitals, but everybody, I mean, I felt like I belonged. You know, that's the best way I can describe it.
That's fantastic. If that's such a tangible feeling of being welcome, belonged, and cared for, that's a signal that you are a place that values value, values quality, values that patient voice and patient experience. That's fantastic. Thank you for sharing, Frank.
Sure.
Looks like Latrell Courtney says, I've seen where some hospitals put the award certificates on display for value-based care that they have received.
Yeah, absolutely. Choosing what you put on the wall for awards received tells a visitor what's important to you. So if those recognitions and certificates are important to a hospital or clinic, then being able to see them as a visitor, being able to see them as a patient is an important symbol about what's important. So that's another great and kind of simple example, but it can say a lot. I think that's a great example of an artifact. Thank you for sharing.
I'd love to hear some others. I can share with one of my local hospitals there. When you walk in the lobby, there's a large display. It's kind of this cutout, and it says, put the I in kind, and it's got the word kind in very big letters. And so staff will stand in front of it so that their body is where the I is in kind. And then they have their pictures taken, and then they post those around. So again, just showing what they value.
That's fantastic. I love that, Rhonda. I can kind of picture it. I know of a critical access hospital that when you go in the hospital, you can right there in the lobby see and access food shelf resources. So they've partnered with a local community organization to bring social care and healthcare right together, trying to reduce the stigma, perhaps, of accessing what is a social need and a social determinant of health by just making it friendly, welcoming, and just part of the health experience is that you can access those food shelf. You can meet your food insecurity needs as you're meeting your healthcare needs. So again, it seems like an important symbol of saying we value value-based care, which is whole person care.
That is wonderful. Are there others that you've seen, Dr. Lundblad, besides that in
So
hospitals?
I would circle back to in addition to the awards and certificates on the wall, I think many of you perhaps do this, but that being transparent about and proud of quality measures and posting those and making sure that a visitor or a patient to your hospital or clinic can see your commitment to quality as part of the overall commitment to value. So could be posting results, could be doing project boards. You know, if you've had a successful quality improvement project, creating a poster board, creating a visual display to say what the team at the hospital or the clinic has done to improve quality is something we see more and more commonly. And again, another indicator to say we're transparent about this. This is the work we're doing. This is where we saw we had an opportunity to do better, and this is what we've achieved.
All right. Well, I don't see any other comments. So just as we're thinking about wrapping up, first of all, Dr. Lundblad, I want to thank you for your presentation and thank you for everyone who attended and participated. Before you do log off, Faith is going to put a couple questions up, a couple polling questions. So Faith, if you will go ahead and do that. And just as a reminder that today's recordings and slides will be available on the Help webinar playback page within 5 business days. Also, Faith will be sending that out to everybody who participated today along with the slides. If you are interested in, Faith did put a link into the chat box for a short online assessment. And if you are wanting to get 1 ACHE qualified education credit for today's webinar, please make sure that you do complete that. And then she will be sending you the certificate. She also, I know she sent she put the link for the email in case you have any questions about RIPT. And if you have any questions or need some more information about the project, please reach out to us at RHPTP@ruralcenter.org. And thank you again, everybody, for participating. I hope you have a wonderful rest of your afternoon. And thank you again, Dr. Lundblad.
Thank you to the whole RIP team. It was a pleasure to be part of your program today.
Thank you.